everyone. So this is the first time I'm doing this live video from my home, and I'm going to talk about endometriosis. Sometimes you wonder why, maybe you wonder why I picked this topic. I picked this topic because I feel there's a lot of lack of awareness, because we usually see patients, women presenting to us at very late stage. Because if you really understand endometriosis, you have from stage 1 to stage 4, and we often see a lot of patients coming to us at very late stage. Partly also because probably they weren't aware that whatever symptoms that they have, whatever feelings that they have, discomfort that they have, was totally not normal. Very often they will have seen some doctors and were told that it's normal, but actually it's not normal. That is why they come to us quite late. And another thing is, I also see a lot of patients actually with endometriosis going through multiple treatments again and again and again, and endless surgeries again and again and again. And it's quite sad, many of them also, I wouldn't say many, but some of them also end up unable to conceive children. So, and if you really analyze the story that they have gone through, very often it's due to late diagnosis. They found out late, they treated late, and that is why it can be quite complicated. Okay, let's start with simple questions that some of you have posted. Okay, first of all, what is endometriosis? Endometriosis is actually we call it is due to the endometrial lining. Okay, if you know the uterus, we have an inner lining. The inner lining is the lining that is passed out during menses every month. So if this inner lining goes elsewhere and grow elsewhere other than in the center of the uterus, it is called endometriosis. Okay, so endometriosis is actually quite common. Partly it's because everybody has the potential to have period backflow. One simple thing that people do not know is that period pain. Many of us grow up living with period pain and accepting that period pain is something that is normal, but in reality it's not. When you have period pain as a teenager, it can still be accepted as normal, but still a large proportion of teenagers who have period pain actually still they actually have endometriosis. There were many reports that have been done, researches that have been done looking into teenagers itself. Teenagers with period pain, more than half of them actually have endometriosis. But these teenagers will probably live through their entire teenage life going to GPs, doctors, and they either accept their period pain as normal, or they would think that it's normal because my mother have it, my sister have it, everyone has it, or they have gone to the GP and then the GP will just give them painkillers, or they go pharmacy and buy painkillers themselves, and they live with it all their life. But even if you have period pain as your teenager, we can still accept it as normal. But period pain should go off with time. It should go off with time. As you grow older, maybe into your 20s, you should not have any more period pain. If you still have period pain in your 30s, 40s, that is really not normal. Long ago, you do hear people, our mothers, grandmothers, aunties, they will say that after get married and give birth, your period pain will go away. In a way, it's true, because later I will cover on treatment of endometriosis. And one of the treatment of endometriosis is getting pregnant. So if you have period pain and you got married and you got pregnant, and after that your period pain gone, then obviously you have endometriosis. Question is your period gone forever? People those days the period go off forever because they continuously get pregnant. They have like 5, 10, 15 kids, but people today, many of us only have like 1, 2, 3, 4, 5 maybe. So by the time you stop giving birth, this endometriosis will still come back. So if you tell me that you have period pain when you were young, then after you gave birth it went away, and then eventually it came back again, then my answer to you is you have endometriosis. If you were to tell me you have no period pain as a child, as a teenager, maybe somewhere in your 20s, in your 30s, then only your period pain came, then my answer to you is you have endometriosis. So endometriosis is actually quite common if you look around. Many of us, like we are already adults, maybe in our late 20s, 30s. You go to work, you go everywhere, you have friends that will tell you, oh, I have period pain. I have period pain, I need to take medicine. I have period pain, I cannot come to work. So actually most of these people will have endometriosis. And the other thing is, a lot of them may have endometriosis, but they probably will have seen a gynae as well, or went for some form of checkup with GP or some wellness centers, and ultrasound already done, and then they could see that everything is normal. So because everything is normal, that is why they accepted the period pain as normal, but unfortunately it's not. I will explain later why it's not. Other than the period pain that you get, any other pain that look like a period pain that happens not just during period, that you can have pain before menses, you can have pain after menses, you can also have pain during ovulation time. The thing that is very interesting about endometriosis pain is it's very cyclical. It comes at a fixed time every month. If you tell me, some women can really tell me, I have this period pain during ovulation. So if they have period pain during ovulation every month, most likely she has endometriosis, most likely. The other thing with endometriosis is it can also have pain at different places. Although most people would tell the general pain, you know, your period pain down here, or some would have a lot of backache, either lower back or even higher up. That could also point out to endometriosis. If you have period pain and you tell me my period pain is always on the right side, or my period pain is always on the left side, then it's not period pain anymore. This is endometriosis. If you have period pain that is always accompanied with something else, that means during period I will have a painful urination. You pass urine, you feel painful, or during period when you pass motion you feel painful, or during period you feel like going to toilet more often, during period you know, some people they actually have diarrhea during the first few days of period, something like diarrhea every month during period. Some people will tell us that if you usually have constipation, maybe during period you can actually have more normal passing motion, no more constipation, which is not normal. During period you have gastric pain, not normal. So all this pain that only happens to you during period, you have to really think about whether you have endometriosis. So again, about why is it a lot of people live with endometriosis all their life and yet they accept it as normal? Partly it's because they go for checkups and nobody told them they have endometriosis. Why? Because most of the time endometriosis cannot see on ultrasound scan, cannot see on MRI scan, cannot see on CT scan. So you scan, everything is normal, and then you think you are normal and you're in a lot of pain every month, but yet everybody tell you it's normal. So why is it that period pain endometriosis cannot see? So basically you need to understand one thing. Endometriosis, there's 3 types of endometriosis. You have endometriosis that happens inside the ovary. So I just want to repeat again, endometriosis is due to the inner lining of the uterus that now grow in any other place other than the inner lining. So we call it ectopic endometrium. So if you have endometriosis inside your ovary, then it will form a cyst. And that cyst, everyone can see on scan, okay? But also need to be of a certain size, maybe not when it's 1 centimeter or 1 centimeter plus, you can still miss it, but 2, 3, 4, 5 centimeter, I'm sure most people would have been able to see it. But other than endometriosis in the ovary, you can have endometriosis outside the ovary. So we call extra ovarian endometriosis. This endometriosis outside the ovary cannot see on the ultrasound scan. Most of the time you can't see it because it can be anywhere. Okay, then there is a third one where you have endometriosis in the muscle of the uterus. This type of endometriosis, initial stages also you can't really see so obviously unless it's grown a bit bigger, but you can also see on ultrasound scan. So if you have pain, menstrual pain, very bad menstrual pain that you still have in your late 20s, 30s, 40s, and ultrasound show nothing, we really need to think about possibility of endometriosis that is not in the ovary and also not in the uterus. Okay, then there's this thing about endometriosis. Now we know there are 3 places the endometriosis can appear, either in the ovary, in the uterus, or outside the uterus and ovary. The ones in the ovary usually not painful, doesn't cause pain. So you see, you scan, you have a cyst, but you have no pain. The ones that are in the uterus, more often they can cause pain, but in very not so bad stages. Some of them they also don't feel the pain. But endometriosis that is not in the uterus and ovary is the one that tend to cause pain. So you have pain and you go for scan and you scan nothing, but actually you can have endometriosis. Or you go and scan and you see a cyst in the ovary. That one, of course, if it's a cyst that looks like an endometriosis, then high likely you have endometriosis. Not all cysts is endometriosis, okay? So yeah, I want to welcome all of you here. Any question, please post it up, okay? I'll try and answer as many questions as I can. All right, so we have covered the pain that you can feel. All right, but there are people who have no pain, because if your endometriosis is purely in your ovary, you may not feel anything. That's why I have patients that come to me with cysts that are big, 5 centimeters, 6 centimeters. But then when we asked her, she feel nothing, she don't feel anything. So when you do surgery on these type of patients, you actually find that there's very little endometriosis outside the ovary. That is mainly in the ovary, so they don't feel much pain. So why does endometriosis come? Very simple. Our uterus has 3 exits, not 1. It's not just for menses to come out. The menstrual blood can actually backflow because you have 2 more outlets, the fallopian tube. The fallopian tube can actually allow the menstrual blood to backflow back into the inside, go into our tummy. And this period blood can go anywhere. So question is why some people backflow, some people don't. I believe almost everyone backflow. The question is how much. Because whenever we do a surgery on a patient that is just after menses, more often than not, we will see period blood backflow. So when the period blood backflow, if it's just blood, it's okay. But sometimes because during menses, we actually release all our inner lining. So when the period blood backflow, so it brings along with it the inner lining of the uterus. And this inner lining of the uterus is very active. It's a very active cell that keeps growing every month. You see the inner lining of the uterus, in our uterus, it grows every month to produce new period blood. So if you have inner lining of your uterus that is brought together with your period blood and backflow, this inner lining is also an active thing that will grow every month, continuously grow. But the only difference is the inner lining in the uterus cavity has a place to go because you have menses, it comes out. But can you imagine this inner lining that's growing every month inside has nowhere to go? Okay, the thing is some women have more backflow, some women have less. So who are they. So that's why a lot of people like to say that the uterus is retroverted, meaning the uterus is bent to the back. That's why it's more likely to backflow. Yes, but that is not the only reason. We have nice uteruses that face in the front and yet they have period blood, and yet they have endometriosis. So many things. The uterus itself, the shape of the uterus, is it tilted to one side, whether or not the uterus, the exit of the uterus, is it a bit smaller, the comparison, the tightness of the uterus exit, and a lot of other reasons which probably nobody knows. But as I say, I believe most people do have backflow of menstrual blood. Now the question is, if your menstrual blood backflow, is it definite that you will get endometriosis? Then the answer is also no, because your period blood backflow, your body should have its own mechanism to get rid of things that's not supposed to be there. You see, when we have a viral infection or any other foreign body into our body can recognize things are not supposed to be there. For example, you have a bruise. When you have a bruise, it's also blood, it's your own blood, blood clots under your skin. And your body can identify that the blood clot is not meant to be there, so the body can remove. But somehow, some women cannot remove. So that is why, even though we realize that there's actually that most women actually have backflow, but not every woman will have endometriosis at the end of the day. So this is a very interesting disease. So why some women have and some women don't have. So based on a lot of reports that have come up, one of the things that I strongly believe, and again I also see in patients of mine with endometriosis, is still very much related to your own body's ability to repair. So one of the things that decide your own body's ability to repair is whether you give a chance for your body to repair. Okay, so one way is whether are you sleeping enough. There are many women today who don't sleep well, whether they don't sleep well because they choose not to sleep well. No, they like to play game, have to look at browse through your phone before you sleep, watch YouTube, watch whatever on your phone. No, this is a new habit. But some people, no, they actually many women nowadays actually also maybe they have no choice but they cannot sleep. Like sometimes I would like to say doctors, nurses, we have actually a very unhealthy lifestyle because we don't actually sleep because we need to work. Those people who work night shifts or 24 hours, I also know a lot of people who on standby 24 hours even though they are not in the medical field. And of course, people who don't have good sleep, either you cannot sleep. So that's why sleep is very important. Sleep is something everyone should find a way to get it solved and not just live with it. Many of my endometriosis patients will tell me they don't have good sleep and they have lived with having sleep problem all their life. Then another thing is stress. Working hours. Do you work the whole day? Oh, don't be like me, do live video at 9 p.m. Actually, it's not healthy. But maybe I won't do too much. But I hope if I won't know, I may do some more. But so you need to have rest from work. You need to have physical rest. You need to rest your brain. You also need to rest your heart, meaning that you need to be happy. You cannot be always angry, always sad, always not happy, always feel the world is against you. So all these things, when you don't have enough rest, your body does not have the chance to repair whatever that is meant to repair. So you have backflow of period blood. You have the endometrial lining that has went in together with the period blood into your body. Your body cannot get rid of it. So eventually it'll find a place to stay, to dry up, and it actually build roots inside. So that is what we see in endometriosis. We usually see a patch of things that is very hard, and if you put a needle and poke that patch, you actually see period blood coming out. It's very chocolatey material. That's why endometriosis. If they grow a cyst, we usually call it a chocolate cyst, but actually anywhere you find it, it also produces chocolate material. So where can it go? So it can go anywhere. In the ovary, it forms a cyst, you can see on ultrasound, and you may not have much pain. In the uterus, it can grow inside the muscle of the uterus, which we call adenomyosis. Initially, we call it adenomyosis, and eventually it will harden and form a clump that continue to grow. Then we will call it adenomyoma. So it's just fancy names, but you can also have endometriosis that go elsewhere, because now blood flow, where also can go, right? So it can go onto your muscles, your ligaments. Favorite place for endometriosis, the ligaments supporting the uterus. That's one favorite place, and there's a nerve there. That's why it's so painful. That's why it gives you period pain. That's why the one in the ovary doesn't give you period pain. The one near the nerve is giving you period pain. It also likes to just grow on the inner lining of your tummy. Okay, we have skin outside. We also have another inner skin inside. So it likes to grow there too. And when it grows there, it can grow very, very near. Very often, it can grow right on top of the ureter. The ureter is the tube that connects the kidney and the bladder. So it's a urine tube. So when it grows there, it can cause blockage. That's why I have seen cases of women with endometriosis and the kidney swollen. If you're lucky, you know your kidney swollen, you're lucky. I also have few cases, especially I had one last year. She was so unhappy because she has endometriosis surgery done twice, and she recently just go for a medical checkup, and the doctor say, dear, your kidney is spoiled already. One kidney is already dead. You're only living on one kidney. Do you know that? And she didn't know that all her life, even though she knows she got endometriosis. Nobody actually checked on her kidney. So, and when you ask her, her symptom is very typical. Every time period pain, she has backache only on one side because it's only on the kidney, and her pain is on the kidney. Her pain is not lower down or anywhere. It's not the lower down type of menstrual pain that a lot of people have. The lower back pain, menstrual pain, I also feel that it's very often is still endometriosis, but her one is very typical, is higher up, which is at the kidney. So if you have kidney pain during your period, then most likely your ureter is involved with endometriosis, and if you don't do anything, you actually lose your kidney. But thank goodness I've not seen people have lost 2 kidneys so far, but I have a few cases that have really lost 1 kidney without even knowing it. So, and they can also go on something that's sitting right. This endometriosis can grow on something that's sitting right behind your uterus, which is your bowel. That's why many women with endometriosis will say that, yeah, probably I have a bit more diarrhea during endometriosis. During my period, during period, I think every time during period, she feel that she pass motion more frequent, or a bit like diarrhea, not really full-blown diarrhea, a bit more frequent passing motion. Usually got constipation, now no constipation. During period, pass motion very easily. So these are some of the things that points out that most likely they have endometriosis, or during period they feel like always want to go past motion, but actually it's not. So this is endometriosis on the bowel. So you can go onto the bowel, and the endometriosis can also grow onto the bladder. So when you grow on the bladder, then the endometriosis cause more frequent urination during menses, can also cause pain during pain during passing urine, only during your period time. So many of these women actually go and see GP for urine infection, but if you look at the way the urine infection come, you only come during period, so it's a bit funny. So when you have period urine infection during period, like almost every month, it's not urine infection anymore, it's endometriosis. Then this blood inside your tummy can go even higher up, it can go to your stomach. So if you go to your stomach, then you have gastric pain. Now these women actually will say they have gastric pain during period. So again, when you have gastric pain during period, you have to be very fun, and you have to think twice. So for those of you who came and just joined me now, okay, I will just repeat a bit of what I said earlier on. But all of you, please share with your friends, okay? I know you're all now all on Facebook. Just please share so that more people can can watch this video and know more about endometriosis. So pain is the commonest symptom. So again, we go back, we have ovarian endometriosis, endometriosis in the uterus, and endometriosis outside the ovary and uterus. So the one that's outside, that is usually painful. That's why you cannot see an ultrasound scan, because this endometriosis outside the uterus usually just have one. They usually appear as one patch that is hardened. That's all. They don't grow things most of the time. So the endometriosis on the uterus is the one that can sometimes have cause pain. The one that we always see on ultrasound is the endometriosis in the ovary, but this ovarian cysts, usually chocolate cysts, do not cause pain. So always remember, period pain is not normal. If you have any period pain, it's better you check properly. So that is I think our biggest challenge, because very often patients with period pain goes to see doctors and still being pushed away for not pushed away, but the doctor say everything is normal, but actually it's not. Okay. So it's very sad to see a lot of endometriosis patients coming to us at very, very late stages. They either come, most of the time they already come to us when scan already show a cyst or show adenomyosis or show adenomyoma. These are the situations where you can see on ultrasound scan. Or another situation, they actually come to us because they cannot get pregnant. 50% of women who are trying to get pregnant and find it so difficult to get pregnant actually has endometriosis. And not all of them have pain. Some of them have period pain. Some of them maybe a bit of pain that they live all their life, but they do not know that they have endometriosis. And many of them don't even know why they are not getting pregnant. It's very typical with endometriosis because everything is normal. They check the ultrasound normal, sperm normal, tube not blocked, menses every month normal. They cannot find a reason why they cannot get pregnant. And then if you really, really look hard, then only you will find that they actually have endometriosis. So for doctors who work with a lot of endometriosis, actually we get clues, because we cannot see on ultrasound scan most of the time. So we look for clues. There are many, many clues that we can look for in women who come to us if we really look hard. If someone comes to me and says she has period pain, if I just do an ultrasound scan, everything is normal, and then I tell her normal, then I can always just regard it that way. Oh, period pain is normal, just go back. But if I'm thinking really, really hard about endometriosis, there are a lot more things that I will do. Okay, so first I will want to know in more detail about her pain. That's why I would usually ask about passing urine, passing motion during period. Where exactly is the location of the pain? Is it a typical place that you get period pain? So in general, if you point me one place, every time period comes here, if you point me just one place, especially it's either left or right, no period pain is left or right one, okay? So when it's left or right, it's usually endometriosis. And then ultrasound scan, we look for features, clues. Sometimes we can see the cyst, we can see adenomyosis, we can see adenomyoma, okay, we can see a retroverted uterus, but sometimes we can't see anything. But we actually, if you look hard, there's certain other clues that we can still find in the ultrasound scan. But there is still a portion of people that we cannot see anything. Okay, that's why if you look into any textbook of gynecology, they will tell you one simple thing. The diagnostic test for endometriosis is laparoscopy, because endometriosis cannot see on ultrasound scan, cannot see on MRI scan, cannot see on CT scan, so you cannot see. So if you really think that this person has endometriosis, one of the things that you can do, or you really think that you have endometriosis, one of the things you can do is to just do a laparoscopy to see. I wouldn't say that everybody needs a laparoscopy, but that is the only way to really 100% be sure whether you have or you don't have. So question is, why do I need to know? No, I have period pain lah. So is it okay that I just live with the period pain? I don't need to do anything, I don't need treatment? But no, because as we know, this disease will progress with time. So if I don't do anything with this endometriosis, so I know I have period pain, but I'm not 100% sure because I cannot see anything on ultrasound. I suspect I may have endometriosis. So let's say I cannot see anything on ultrasound. Is it okay to just live with it? There are a few problems that we will face when we you need to know that if you live with endometriosis leave it alone, there's 3 problems. There's always 3 problems. I always say 3. Endometriosis is all 3. Okay, so we have 3 types of endometriosis. just now I mentioned. So now we have three problems that can potentially happen. Number one, we all know that endometriosis can be potentially cancerous. Okay, 3 to 5% of people who have endometriosis actually can develop cancer. Somebody just asked me, can you do laparoscopy if you are not married? Laparoscopy is through the tummy, nothing to do with married or not married. Yes, in fact, not married also you can do endometriosis, and I would do more because being not married, your chances of endometriosis is also higher. Especially if you're not married above a certain age. Sorry, of course, if you're a teenager, you're not. Alright, so first thing is we worry about cancer risk because endometriosis, once you have endometriosis, especially ovarian or the ones in the uterus, they can actually turn cancerous. Number two is the pain. The pain that you're suffering from can be very, very bad over time. So you see, the pain is due to the endometriosis that spread to more and more places. So we know that ovarian endometriosis, although has higher chance of cancer, but actually don't give you pain. But the endometriosis in the uterus muscle, as well as the endometriosis that is outside the uterus and ovary, actually can cause a lot of pain. Pain can worsen with time, in the sense that the pain intensity worsen. That's why a lot of these women, they live with the pain the first 10 years of their life. The next 10 years they need painkiller. Then the next 10 years they probably need to go and see doctor for injection. Something is not right. So some people come to us only at that point, when they really start taking injection or painkiller, they feel something is not right. So pain can be worsened over time, and if you wait some more, maybe the pain will not even cure with painkiller. Some of them, I tell you, some women are just so beautiful. The pain is so horrible. Okay, so second is not just the pain getting worse, but the pain, the number of days you have pain. So it started with period 1 day, then it's period 3 days, then it's period 5 days, now it's before period and during period, and then now it's before period, during period, after period, and then now it's the whole month. So you see, the number of days you have the pain can also increase over time. And another thing will be the place that you have the pain. Now you have the pain in one place, but because the endometriosis can grow in new places, so you have more and more pain at more and more places. And some very, very bad cases, the things that we are worried is what? Those that are on the urine tract, because your kidney can die. Those that grow on the lungs, the diaphragm, actually is due at the diaphragm. Every time you breathe also pain. How like every time period come you breathe so pain, no need to breathe. So you see, these people really, really suffer. So the pain can be so bad that that's why we somehow need to treat it. So first is we scared of cancer. Next, we scared the pain become worse and worse. Third is cannot get pregnant. Okay, half of endometriosis patients cannot get pregnant. They find it so difficult to get pregnant. I wouldn't say cannot, but they find it so difficult to get pregnant. Half of them can still get pregnant, half of them don't. You see, so long ago, a lot of our aunties say that after our grandmother say period pain, give birth already, no more period pain. Actually, this is endometriosis lah. Okay, so but then these people those days can still get pregnant, but this is the problem of women today. Why? Because your grandmother tell you that, right? Your grandmother get married how old, right? How old are you getting married today? So women today get married at a much older age group. So even though you do have, your grandmother got endometriosis, get pregnant, no more period pain, but you get married at such an older age, your endometriosis is worse now. So pregnancy may not solve your problem. And worse still, I don't even know whether you can get pregnant. Your grandmother can get pregnant, but you may not be able to get pregnant. So half of them, only half, because there's still a lot of women who will tell you that after give birth only got period pain, or after give birth no more period pain, and after that the period pain slowly come back. So all these people are still definitely having endometriosis. Okay, so now we know that we need to treat. So if people come to me at let's say in their 20s, and then they tell me either late teens, early 20s, or even mid 20s, especially if you're not married, and sometimes it's very obvious you have endometriosis. We put ultrasound already, scan got already, and they may say that some doctors told them the cyst is very small, don't need to treat. I always say that is very, very, very outdated thinking, because yes, That's what we were told, no? Anything more than 5 cm only you operate, less than 5 cm just leave them alone. But you must understand, if I leave you alone, you're not even married yet. You may get married like at the age of 30 and 35. How? After you cannot get pregnant. So sometimes I say, yeah, from the health point of view, the pain is still bearable, right? 3 problems. Pain is still bearable. No cancer risk because everything is still so small. But what if you cannot get pregnant in the future? Maybe you can still get pregnant today, but you're not married yet. But what if you cannot get pregnant in the future? I won't sit down and wait. If I were you, I would not just leave it alone. I would get it treated. Okay. So that is the first thing I would think. So treatment. Many of you ask me about treatment. Treatment, you ask me. There's also 3 types. So I say endometriosis, everything is 3. Okay. 3 types of treatment. First is pregnancy. You already know, get pregnant, no more period pains. So get pregnant, endometriosis will resolve. But depending on how bad your endometriosis. Let's say, okay, make things simple. Actually, endometriosis, we do divide stage 1, 2, 3, 4. Okay. Maybe your endometriosis is stage 2, and then you get pregnant 9 months, no period. No period, endometriosis solved. Actually, as long as you have no period, you solve your endometriosis. Let's say you got pregnant, your endometriosis is stage 2, and then you got pregnant. So maybe after you get pregnant, give birth, your endometriosis regress and then become stage 1 or become 0. But if your endometriosis is already higher level, even if you get pregnant, you need to bring it down. It doesn't totally solve. But the other problem with endometriosis is that it doesn't go away forever with pregnancy. It actually resolves, but it will come back. That's why a lot of women also will tell me that after married, no period pain. But after a while, as the child grew up, 1 year, 2 years, the period pain come back. I have also seen people with chocolate cysts. You already see the chocolate cysts. And then they got pregnant, the cysts will shrink. But after they give birth, 1 year, 2 years, 3 years, slowly the cysts will come back. So actually pregnancy is a form of cure, but it's not a permanent cure unless you are like our grandmother's law. That's why grandmother always say after give birth no period pain, right? Because grandmother continue to give birth ma. So if you continue to give birth every 3 years for the rest of your life, definitely no more endometriosis, right? So pregnancy is one. Second one is medication. Yeah, there are also there are many medications available since a very long time, but most of this medication has some amount of side effects, and the problem is that endometriosis you cannot cure. So if you take medication, actually it again same like pregnancy, it will resolve. So if you take your medicine for 9 months, then you also resolve. But then I always say the roots are always still there. So taking medication is again, we're talking about until menopause. Actually, the only way to cure endometriosis is to menopause. So if I take medication, yes, it can regress, but I must be ready to take medication until I menopause. Because if I don't, it will come back. It will come back. Trust me, it will come back. Endometriosis is not so forgiving. And last of all is actually surgery. Okay, surgery is one of the way to treat endometriosis, and probably is the only way to treat on endometriosis, where you can actually remove the endometriosis. So you remove the roots now. You don't just don't just regress it and then all the roots are still there. Now you really remove the endometriosis with the roots. But one thing is, we know endometriosis is due to what? Backflow of period blood, right? So if you remove everything, there will still be backflow of period blood with time, and over time it will still come back. But only difference is it takes a longer time to come back. It takes a longer time to come back. So surgery is probably the only way to make the endometriosis go away for a longer period. I'm not saying that everybody needs surgery, no. In fact, a lot of my patients are also still on medical treatment. So medical treatment, there are many options. So depending on the severity, and very much dependent on you, what you want. You know, some people are very scared of eating medicine every day for 10-20 years, so they rather have a surgery. Or some people, the moment you talk about surgery, they run far, then they rather take medicine. Okay, so There is another situation that I always notice that a lot of people, even after they do surgery, then they grow back, and then do surgery again, and they grow back, and then do surgery again, then they grow back. You see, it's very, very sad, you know, keep doing surgery. But honestly, one of the reasons why they keep doing surgery is because they didn't do the right thing. Because if you understand the principle that I've just said earlier on, so you know that surgery is only a temporary solution. So you still need to do something to make sure that your period blood do not backflow, to make sure that your endometriosis do not come back. You still need to do something, you know. So yeah, what is it that you need to so what I usually tell people, if you're going to get pregnant after give birth, you don't just let it be. You need to be on some medication, you can do some simple medication to prevent it from coming back. Okay, I personally have endometriosis. 20 years ago, I did a laparoscopic surgery for my endometriosis. I don't have endometriosis coming back anymore. You know, I have kids. My youngest child is already 14. So even for these 14 years, endometriosis don't come back because I'm always on a Mirena. I never stop my Mirena. So if you get pregnant, you put something. If you're taking medication, you need to take medication until you menopause. If you choose to do surgery, after surgery you still need to go on certain medication. If you want to get pregnant, you get pregnant. After you give birth, you still need to go on certain medication. You see, medication got strong medication, not so strong medication. I always say medication has medication for treatment, we have medication for control, we have medication for prevention. So minimum, if you think you have treated your endometriosis well, you still need to be on preventive treatment. So until you menopause, if not, endometriosis doesn't go away forever. Okay, so always remember that. All right, so yeah, another thing, just now I did mention that there are many people who keep doing surgery. One of the reasons why they keep doing surgery is there are many reasons. Why. Okay, some people wonder why some people do one surgery can last for 10 years and they're fine, and some other people every 2-3 years grow back. Okay, to be very honest with you, this endometriosis is not an easy surgery because it can grow everywhere, right? Just now I told you the backflow of blood. They can go to the ureters, the urinary tract. They can go to your bowel. It can go stomach. It can go lung. It can go everywhere. So surgery for endometriosis is not simple. And very often, what happens is patients come to us at very late stages. Just now I also mentioned endometriosis got stage 1, 2, 3, 4. So if you come to me at stage 1, I definitely can remove everything. But you come to me at stage 4, where it has gone everywhere, sometimes we cannot remove everything because the way we do the surgery may not be the right method of surgery. Or sometimes, if I'm going to remove everything, you may not be able to accept it. Because sometimes some patients come to me at very, very bad stages. I will tell them, it's so obvious, your bowel got that big chunk of endometriosis that I can even see on your bowel already. Because just now I told you, I cannot see endometriosis on the bowel one. But if I can see already, so it's obviously not going to be simple. So if I'm going to do a complete surgery for you, then your bowel also need to do surgery. Some patients willing to accept it, but some patients not willing, especially first time people who do surgery first time, a lot of time they're not willing to do a lot of things. So sometimes I'm very honest with them what they have to face if I want to do a full surgery. But some people they want to be more conservative. They will say, okay, I will take medication after that. So well, if you want to remove 90% and the 10% I leave behind, you continue with medication, I think that's also a fair choice. So sometimes patients come to us late. So that is why just now I say a lot of time we feel very sad because people come to us already late. They come to us when the period pain is already so unbearable. They don't come to us when they have period pain, that's all. They come to us when it's so unbearable, or they have seen many doctors and ultrasound normal, so they always live with the fact thinking that their period pain is normal, but actually it's not. So So if you come to us early, of course it's easy to treat, but if you come to us at a late stage, we go and do surgery. Maybe the endometriosis is at a place that you cannot, you are not willing to remove. So first thing is, if you want your surgery to be effective as a form of treatment, number one, you need to operate early. So I really do not agree with any doctor who say that your cyst is still small and you can wait. Because if you wait, then eventually it's going to be bad, and then you're going to come to us late. Because today women and last time women is not the same. Those who say that the cyst can wait is old school of thought. Yes, last time my teacher would teach me after 5 cm, simple. You get endometriosis, anything more than 5 cm, operate. When you do the operation, remove uterus, ovary, all remove, settle. But women today cannot remove uterus or ovary because they're all still not married, no children. How? So it's not the same as women those days. So no, we want to treat them early so that we can have a complete treatment, so that they don't need repeated surgery. So first, present early, treat early. That is the most important thing. Second criteria is, if you were to choose surgery as your option, okay, there are 3 methods of surgery. Again, endometriosis, everything is 3. You can do open surgery, you can do laparoscopic surgery, you can do robotic surgery. So now there's 3 types of surgery for endometriosis. And doing endometriosis for this last 15-20 years of my life, I realized one thing. Okay, one thing is, I will never do an open surgery for endometriosis, because that is like almost guaranteed that I will not remove everything. Why? Because I can't even see everything. So open surgery is something where you open up the patient's tummy and you look inside. So first thing you must understand, backflow of period blood. So which means that the period backflow most of the time is behind the uterus. So when I open the person's tummy, the first thing I see is the patient's uterus. Then I see the patient's uterus. To see things behind the uterus, number one, is not so clear because it's behind. Number two, is actually quite far from my eyes to where the thing is. Of course, if you have big chunk, everyone can see lah. But what if you have smaller chunks? But these smaller chunks may be at important places, like the places that causes you pain, places that causes the urine tract to be blocked, you know. So that is the first thing. Second thing is, the endometriosis can spread to somewhere far from the wound. You see, when we open the tummy, we open one area only. We don't open the whole tummy, you know. So the endometriosis can actually go higher up, and you probably cannot see it if you just cut right below, because most gynaes cut right below. So we only see at a very close place. So open surgery is never the way to go. So that is why this endometriosis surgery actually became more and more complete after we have laparoscopic surgery. Because in laparoscopic surgery is when we put a camera into your belly button. So when we put a camera into your belly button, I can put the camera and turn one whole round, right? I can see the whole tummy. So one camera in your belly button can do a surgery up there, can do a surgery down there. So that is when you can see everything better. Another thing is, the camera can put very close to where the place of the endometriosis. So now I can see the endometriosis so much clearer because it's right in front of my eyes now. So usually when I do endometriosis, I will make sure my uterus is way in front, because most of the time the endometriosis is behind the uterus. I will make sure it's pushed all the way to the front, and I can get to see the whole back of the uterus, which is again a very important criteria. Because I still do get videos of people who have operated before, and they show me the video and I say I can't even see the entire back. I'm not really sure whether the entire endometriosis is removed. So I need to see the entire back. So now my laparoscope can go in and see the entire back of the uterus. So when I see the entire back, then I can remove whatever I see that's not supposed to be there. See? So laparoscopic surgery, for one thing, I can see the back clearer. Number two, I can go run round and look for other endometriosis anywhere else. You know, endometriosis can appear anywhere. It can go higher up. And of course, not to mention endometriosis got faster recovery lah. So why you want to do open surgery? Then you have to suffer so much longer, and yet you cannot remove all your endometriosis, right? So it doesn't make sense. And then the third option is robotic surgery. Oh, why then robotic surgery better than laparoscopy? Is it better? It's definitely better. Why? Because not only now, because robotic is same like laparoscopy, I put scope in and see, but not only I can see things close, but robotic surgery give you a 3D view, so I can see clearly, but I also can see the depth. And in endometriosis, I usually feel that actually I love robotic because it's not just the depth. In endometriosis surgery, a lot of times in endometriosis, we have a lot of pelvic adhesions, which I have not mentioned earlier. This period blood that is inside actually tend to form like a glue, you know? So it can stick two things together. So you can stick your bowel, your uterus together. So to remove this thing together, we need very, very close-up view, number one, and an image that can actually see the plane between these two things. And this is something that robotic has the advantage. You can actually see the plane so clearly. So some endometriosis, especially stage 3 and stage 4, actually when you have stage 3 and stage 4 means everything is stuck together already lah. The bowel, the uterus, the ovary all stuck together. So we need to open it up first, because if you cannot open it up, then how to remove everything, right? So in open surgery, to open up is also very risky because we cannot really see so well inside, unless we make a very, very big cut in your tummy. Can lah, no, like some of my old teachers used to teach me, be generous with your cut. So cut open bigger. But I also pity patient if you have to open bigger in order to see inside really, really well. But in laparoscopic surgery, we can actually see everything, but the plane may not be so clear compared to robotic surgery. So if you ask me, if I have a choice to do a patient for endometriosis, I will always pick robotic surgery. Unless I have no choice, I'll still do it laparoscopically anyway. So I told you the first thing why they keep coming for repeated surgery. First, because they come late. Number 2 is the choice of surgery. Okay, choice of surgery, and also number 3 is whether your surgery remove everything or not. So sometimes, like, I can tell patients that 100% remove. Sometimes I tell them, 90% because the part on the bowel, maybe you don't want the bowel surgery. Because bowel surgery, you need 3 months of colostomy, which is something not many women are willing to go through. So sometimes we tell patients whether we can remove 90%. But the sad thing is sometimes we do see cases where the cyst is only punctured, because even you ask me, I'm very honest with you. If 20 years ago that was what I'm doing, because that's what I was taught. I still remember I had one stage 4 endometriosis when I first became a specialist in a government hospital. So at that time, I went in stage 4, I'm shocked, I'm panicked, I don't know what to do. So I went and asked my senior to come in, who is actually very, very senior in my department. And she came in and she told me, Tan, what you try to do? Just puncture it and suck and clean. So you see, there are some doctors who just puncture your cyst. If you puncture your cyst only and clean everything, definitely the cyst grow back within the next few months. Okay, so that will be one thing. Number 2 is some people, they just remove the cyst. You have ovarian cyst because you see your ultrasound scan, you have ovarian cyst, so they remove the cyst, but they left behind all the endometriosis on the urine tract, on the bowel, on the muscle, on the ligament. Then definitely your disease will come back very, very fast. Yeah. So the choice of the type of surgery to do and whether your surgery did remove everything. And last of all, do you have any more medication after your surgery? As I told you, it's a must, it's a must, it's a must. Even if I remove 100%, your period blood is going to backflow. I still need to use some form of medication to make sure that my period and my period blood do not backflow anymore, my endometriosis do not come back anymore, it is a must. Okay, don't. Many of you take medication 6 months, 1 year, 2 years, and then stop. Please don't stop. You know, you cannot stop until you menopause. As long as you're having your menses, endometriosis will come back. Okay, some people even go for traditional medicine and they tell me that they feel less pain. I say you can feel less pain, but as long as your period is still coming, I don't think your endometriosis will go away. Okay, so you need to be on some form of medication that, if possible, don't give you menses, give you as little as menses as possible, and that is how we control endometriosis. Okay, yeah, okay, I think I've gone through quite a lot. Yeah, maybe just one last thing on people who are trying to get pregnant. Okay, so typically I see a lot of these cases, a lot. Okay, they want to get pregnant, they cannot get pregnant, they know they got endometriosis, they do a surgery. Then after they do surgery, another 3-4 years, the endometriosis grow back, and then they still cannot get pregnant even after the surgery. Then the endometriosis come back, and then they do surgery again and surgery again and surgery again. Oh, don't do things like that. So when you do a surgery and you are trying to get pregnant, you have to get pregnant. It's not an option. You cannot sit down waiting. Don't ever wait for your baby to come. If you wait for your baby to come, you're waiting for your endometriosis to come back. Everyone who do endometriosis surgery and trying to get pregnant, because when you're trying to get pregnant, you can't be on any medication to prevent your endometriosis from coming back. So the only way to prevent your endometriosis from coming back is to get pregnant. So if you have your endometriosis surgery done and you're trying to get pregnant, you have to get pregnant. So the effort to get pregnant has to be a lot times more than the rest. So you have to do a lot of things. You cannot just try on your own and just let it be. No, it doesn't work that way. Endometriosis will come back. So if you remove your uterus, does your endometriosis come back? Yes, because if your ovary is still there, endometriosis can still come back. Let's say if I remove my whole uterus, but I leave behind still a lot of endometriosis on my bowel, or my ureter, on my muscle, or my ligament, or whatever, then the endometriosis can still come back if your ovary is there. If I remove my uterus and the ovary, then the endometriosis won't come back anymore. If I remove 2 ovary, leave behind my uterus, also I got no more endometriosis because no more period anyway without ovaries. So yes, of course, that is the ultimate solution, which a lot of, I would say that is how we were taught 20 years ago lah. 20 years ago, you got cyst, you keep it until it's very big, and then big already or very pain already, then just go and do operation, remove uterus, ovary, everything remove, one surgery solve all problem. But no, not for women today, because number one, many of women with endometriosis are still not married or no children. Number two, women today, they do not want to remove their ovary and uterus, because they know that after they remove their uterus plus ovary, especially if ovaries taken out, they still have a lot of problems when they grow older. 20 years ago it's okay, because women 20 years ago are a lot simpler. You just put them, take out everything, they accept it. But women today, they are very educated, they know that it's not the way. So that's why it's better to do things, treat early. As I said, treat early. Yeah, treat early, right choice of treatment, and preventive treatment until you menopause. That is the way to go for endometriosis. Okay, thank you. I'm going to end my talk now. Yeah, it's 1 whole hour already. So I hope with this video, I don't have to repeat this so many times. Actually, every endometriosis come in, I say the same thing. Oh, I can't imagine. I actually speak to every one of them almost an hour every time. Okay, bye. Bye.